with conventional oral therapies that brought about our solution. So I mentioned that we have challenges with first pass metabolism and also what we call the gastrointestinal side effects, as well as poor patient compliance. And this is caused by multiple daily dosing and repeated dosing of oral therapies. So what's our solution? So we actually identified a phyto drug called Diosgenin. So this phyto drug is a naturally occurring phytosteroidal sapogenin, and it can be found in a plant called white yam. We have different species of this plant, and this phytosteroidal sapogenin as a promising anti-diabetic agent. So, but however, Diosgenin, this phyto drug, has what I would tag as a very critical limitation, and that's due to its sparingly water solubility. When it comes to its oral bioavailability, it is very poor. And researchers have confirmed that only 7% of this phyto drug is bioavailable orally. So, what's our strategy? We've felt we can actually overcome these challenges when we develop, instead of oral, what we call a transdermal delivery system using nanoemulsion technology. With this approach, we know that we should be able to bypass the first pass metabolism, and what we call a sustained drug release can be provided. And with this sustained drug release, a non-invasive an alternative to oral administration is promised. So the objective or the aim of this research is to develop and comprehensively evaluate a stable oil in water nanoemulsion and nanogel system that incorporates Diosgenin for effective transdermal treatment of type 2 diabetes mellitus. So let me walk you through our methodology. So our formulation approach employed what we call the low energy phase inversion composition method. We coded this as LEPIC method. It's a simple method, it is cost effective, and it doesn't require sophisticated equipment or high energy equipment. So the basic components in this work for our formulation is the oil phase, a surfactant system, and the active ingredient, which is the Diosgenin. So this formulation was actually taken through some optimization strategy. So we use what we call the Bose-Benken design to get 13 randomized formulations. And we look forward to some critical responses. That is the particle size of our nanoemulsion, the drug release profile of the nanoemulsion, the viscosity of the formulation, as well as the pH. So we also went ahead to get our pseudo-ternary phase diagram. So here we constructed 3 phase diagrams at different surfactant to co-surfactant ratio. So at the ratio 1:1, 2:1, and 1:2. And from our optimization, we have the 1:1 ratio to show the largest nanoemulsion region. And this was then selected for further development. So our final formulation was taken, which involved 60% oil phase and 25% surfactant mixture. Then our final formulation was taken forward for characterization techniques, and we had the scanning electron microscopy for morphology. We exposed our nanoemulsion to field emission SEM microscopy, and also the dynamic light scattering for particle size and polydispersity index, as well as FTIR, to be able to identify the functional groups and stability of the obtained nanoemulsion. We further also developed what we call the T2DM animal model. So this is what the STZ induced T2DM rat model was developed, and a particular weight of STZ was used to induce diabetes in selected rats. We actually used Wister rats, and treatment was administered to these diabetic rats after confirmation that the rats actually developed type 2 diabetes mellitus. So from our results, excellent formulation characteristics was obtained. For example, for the PSD, the particle size distribution, The optimized formulation actually showed a particle size range from 92 to 265 nanometer across all the 13 formulations. But formulation F6, the one that was finally selected and best for this research, showed the smallest particle size, and this was around 82.3 nanometer. And this is actually ideal for skin penetration because of the skin barrier. Then the polydispersity index actually ranged from 0.01 to 0.40, and this is actually communicating a low PDI value. And a low PDI value at this range confirms excellent homogeneity and a monodispersed particle distribution. And this is actually crucial for a stable nanoemulsion. Then the morphology revealed an almost spherical and nanoparticles that seem unaggregated with smooth surfaces. Our viscosity profile there also ranges from 18.8 to 57.3 centipoise, and we observed a decrease with increased water content. And this is actually ideal for topical skin application. Then our thermodynamic stability of our formulation also showed a very wonderful stability, including the FTR-IR analysis, the functional group analysis. We did this at day 0 of the nanoemulsion and also day 90. And we observed that there was no chemical interaction between diosgenin and the excipients, the surfactant, the co-surfactant, and the oil. So this confirmed formulation stability. And this also showed stability over 3 months of storage, even after 2 years. Then the drug release profile is actually very exciting because we observed a slow and a continuous sustained release pattern, and this took for over 15 hours. So an initial burst was observed or took place at the first 30 minutes, and this our selected formulation maintained a steady drug release, and we achieved 92.95% cumulative release after 36 hours. So this actually supports the application of this emulsion at a once daily dosage. Then we exposed our rat skin to what we call histological examination after the application on the rat skin, and there was no sign of irritation, scarring, or tissue damage. So this confirmed the safety profile of our formulation for transdermal use. So we went further for in vivo studies, and the result is presented now. The first is the blood glucose normalization. So we treated with this our emulsion. Sorry, I didn't mention that it was taken forward into what we call a nanogel for easier application, and we tag this as DGNEG. That's Diosgenin-Nanoemulsion gel, Nanoemul gel. So at this stage, when it was applied, we realized a significant reduction in the blood glucose level compared to the diabetic control group, which was approaching a near normal value. For the HbA1c reduction, we also observed that the glycated hemoglobin level, which is a marker for long-term glucose control, was significantly reduced in animals treated with DGNEG. So this actually implies an effective glycemic management over the treatment period. Then we further exposed to other organs because type 2 diabetic mellitus can actually lead to lots of complications affecting the liver, the kidney, and the heart. So all this were done, and the result demonstrated that the transdermal delivery of diosgenin via nanoemulsion system not only control blood glucose but also prevents diabetes-associated organ damage. So conclusively, we can boast of 3 major achievements. And the first one is the successful development of a stable nanoemulsion system, because we were able to successfully formulate a kinetically and thermodynamically stable emulsion, and the result of the size was interesting, a 92 to 265 nanometer with a low PDI, and also our formulation remains stable for 90 days with no phase separation or chemical degradation. You have the picture there in the tube. Then the second achievement we can boast of is the sustained drug delivery because over a 15 hours, our release profile shows convenient once daily topical application, and this can significantly currently improve patient compliance compared to multiple daily oral dose. And third success is the significant therapeutic efficacy that was confirmed from our in vivo studies. A remarkable result of a normalized blood glucose level, reduced HbA1c, protection of multiple organs, including the pancreas, the liver, kidney, and the heart was reported. And for future direction, I will recommend that the molecular mechanism, although we are currently conducting that, and we're also looking into an extensive clinical translation so that we can investigate the molecular mechanism underlying this multiple organ protective effect of Diosgenin. So I would like to acknowledge our collaborating institution, Federal University of Agriculture, Abeokuta, Nigeria, Amity University, India, Green Nano LLC USA, the University of South Africa, and a special thanks to TWAS DBT for sponsoring, for funding this support. Thank you so much for your attention. We'll be happy to answer any questions you may have. Thank you. Okay, what did the scanning electron microscope and the FESEM review? Okay, actually, the scanning electron microscope is actually showing us the dispersion of the Diosgenin in the oil and water phase, and it will also let us know if there are any kind of cluster obtained, if there are any kind of aggregation, as this is important to aid its penetrability of whatsoever nanoemulsion size that is formed. So because the skin has the size of particles it can accommodate, we decided to go for a nanoemulsion with a very small size that can easily penetrate and reach the site of action. So, and the particle size of 92.3 was visualized, and we are also having a uniform size distribution. So I can clearly say that our same result is just letting us know the size and dispersion of our Diosgenin in the nanoemulsion matrix. And for the FESEM, because this one will provide some kind of higher resolution, and we decided to go further, not relying only on the scanning electron microscope. So this confirmed to us that Diosgenin was actually present, and also probably if it is uniformly distributed in the nanogel structure, because this time around it's a gel, so we need something that is of higher resolution to be able to discover or identify the presence of the emulsion in the gel for the therapeutic effect that we actually require. So we captured images at 15,000 magnification, and our scanning, our Diosgenin were seen. Thank you so much if that answered your question. Okay, there's another question.